The views and opinions expressed on the following program are not necessarily those of the staff and management of Salem Media of Hawaii.
Welcome to Generations Radio, where the focus is on our seniors and their families. We are here each Saturday afternoon from 5 until 6 p.m., bringing you resourceful information with our radio team of professionals in the field of aging. Stay with us for the next 1 hour as we explore different ways to make life more exciting and meaningful for our extraordinary seniors. Right here on AM 690 The Answer. And now, here is our host and the publisher of Generations Magazine, Percy Ihara.
And welcome back to Generations Radio. I am Percy here. Thank you for tuning us in. If you're listening to us online or from our YouTube channel, thank you very much. Make sure when you go to YouTube channel, when you can click on Generations Magazine, subscribe to our channel, because whenever we get a new posting of a new show, you'll be able to get an email link to that. It's very important because we take about a week to 2 weeks before we get it up online to our YouTube channel. Hopefully by the end of the year, all of these will be on our website, generations808.com. So we've been toying with this website for the last 2 years. People love to go there, and that's why we're trying to get it more efficient and more effective. So you can go there, but the new shows are right now for the last probably 6 to 8 months are on a YouTube channel. So go over there as well. So anyway, thank you for tuning in. And thank you for all you baby boomers. What's interesting in the last probably 6 months, I'm getting more calls and emails from baby boomers looking for resources for their parents. And so I would recommend you call our guest, because not that I won't talk to you, but I'm very inundated throughout the day with calls, emails, and texts. So sometimes if it's faster, I would just tell you call our guest directly. So we always put our guest phone number and email and websites on our shows. So thank you very much again for tuning in and checking our magazine out. Don't forget, now we do have kiosks or little magazine racks downtown on 4th Street Mall, right in front of actually the Pioneer Plaza. There's a bunch of racks down there, right in front of there. We're on Bishop Street, right by Bank of Hawaii. We're at the post office on Richard Street. We're at the corner of Alakea and King Street on that Mauka Diamond Head corner right by Central Pacific Bank. And then we're all the way down on King Street by Down to Earth, which is a very popular location to pick it up. So you can pick up our magazine out there. Very shortly, if not already, you'll see the June-July issue coming out with Mo'iliili Community Center on our cover story, and they're celebrating 150 years. The original building's still there, but the main facility's been there for over 50 years. So thanks to Nadine Nishioka there, the executive director, for bringing the kids out and the seniors out for our photo shoot and for the story. So thank you very much. Anyway, we have in one of our few repeat guests, by the way.
Oh, thank you.
Mr. Steve Ito from House Call Medical. Welcome back to the show, Steve.
Thank you so much for having me, Percy. Greatly appreciate. Love being here.
Yeah, well, you do a unique service that I work with seniors every day, and we always run into situations where I let's meet Wednesday. Oh no, I can't meet Wednesday. I have a doctor appointment. I said, what time is the doctor appointment? 9 o'clock. Well, can we meet like 12, 1 o'clock? Oh, no.
During your lunch hour, correct?
It's the whole day. They're gone the whole day. That's a big event.
Yes.
And so that's what I love about your business, and I'm trying to encourage people to look at your business, because House Call Medical means exactly that, Steve, right? So why don't you explain really quickly?
Yeah, so in a nutshell, exactly that. It's very convenient. We're bringing back the art of that door-to-door doctor who comes to you, provides all of your primary care needs at the comfort of your home, all the conveniences that you've just mentioned, as far as not having the time to go, not meeting up with the doctor's appointments and what you're doing in your daily life.
Doctors are so busy today. It's crazy. I love my doctor, don't get me wrong, but I see him once a year, but I have to plan almost 8 months in advance.
So that you can have the time off.
Right.
Correct.
No, for him to see me.
The opposite way.
My doctor's great. So we've done this for like the last 10 years. I have to plan at least 8 months in advance.
Wow.
For my next appointment.
And, and a lot of that too, there's a shortage of primary care providers around the nation.
Oh, my goodness.
And we like to help fill that gap. Those conveniences that you've mentioned for working professionals such as yourselves, and even for those older adults who are listening, the baby boomers who are unable to get transportation to their doctor, And then same thing, not getting access, having to wait 2 weeks for something when they need something that same day. And so we can help fill in that gap for you. And the great thing about this practice is that you can keep your current doctor. That
Right.
that doctor that you've seen for years and years and years, you don't have to give them up, and we will work with him or her and any of your other specialists to update them with your care.
Yeah. What's cool about your service is that, a lot of times the seniors, they cannot, they have to schedule appointment around their children's who's driving them to the doctor.
Correct.
And their schedule, right?
Yes, and that's where we fill a nice niche for some of these older adults. Just having that access to care, that same day appointment. We try to come in there for a lot of those children of seniors who are unable to exactly that take their parent to the doctor. Maybe they're bedbound or they require a handy van, and so they might not even have the right transportation to do so if they wanted to. We fill that gap.
Oh, yeah, because the handy van, they do great work here, but I mean, they can only serve so many people a day.
Exactly.
And like I said, I think people complain about it all the time, but people gotta realize, hey, handy vans are busy. It's a busy
business
service, and obviously working with seniors, they can't come and pick up and leave right quickly. They have to wait for you. They have to load you up there. I mean, so I tell people to stop bashing the handy van because they're doing the best work they can possibly have with the funds available.
Correct. And so, it's really great for those patients for the conveniences of having this great access to care where we can come to them whenever they need us, and to really just kind of help them in any way possible. One of the things that a lot of my patients love about our care is the time that we spend with them. We're not constricted to an insurance-based model. Right. 5, 15 if you're lucky. Yeah. And so, it's not the doctor's fault. It's just that the way that the system is set up, they're not allowed to spend the time that they would want to. And so a lot of my patients appreciate that I can spend an hour with them at the home.
An hour?
2 hours even sometimes for some of my more complex patients. And they really appreciate the thoroughness of it because they understand why they're taking a certain medication for their Alzheimer's disease. They understand why they have to do certain blood work and the results. The results are very important for you to understand. And so we take the time and give them the quality of care that they deserve, that we deserve to give to you two as a patient. And it's great all around. I think they really appreciate that and they feel comfortable after each visit.
So what kind of services besides you do you like annual physicals, blood work? What kind of other services you do?
So besides primary care services, everything that your general doctor does for you, taking care of your hypertension, your diabetes, your arthritis, these are all things that we can take care for you at the home now. So talking about diet and exercise, weight loss programs, your nutritional goals, medications, and all of these things that are involved in keeping you healthy as an older adult and just as a person in general. We take care of all these things for you. Minor injuries, colds, of course, if you have a cough, the flu, if you're suspecting maybe rat lung disease, that's been going on
later on. But yeah, but it's really important because when I see seniors, if I see them coughing, I tell them, go see the doctor immediately. Yeah. Well, he's kind of busy, and I don't have time. And then my son's working. He can only take me on Saturdays. That's really important, don't you think?
It is, and for a lot of older adults, they deteriorate a lot more rapidly than a younger adult who's in their 30s, 40s, or 50s. As you get older, the immune system is not as strong, and that's just part of the aging process.
Yeah, you're right. You're exactly that. So if you're listening, baby boomers, you're wondering why your mom gets cold more often as you get older.
Exactly.
Your immune system gets weaker.
And they tend to develop pneumonia or bronchitis a lot quicker than a younger adult.
Yeah, I see that ammonia a lot. Why is that?
So for pneumonia, community-acquired pneumonia, it's something that's a lot more common for older adults for the reason that I just mentioned. Either they're
can you only get it from somebody else?
Well, a lot of the times it can be transmitted through contact from another person, but more importantly, it's developed when a patient gets a cold and simply their immune system is weakened, they can't fight it off, and then bacteria just takes over. And that bacteria is what turns into pneumonia. And a lot of patients may not even know they have pneumonia. I'm sure you've heard the term walking pneumonia.
I had that.
You did? Wow.
Well, I would say about 20 years ago, I was working a lot. I mean, I was probably working 6, 7 days a week, 12 hours a day. I was so busy in the mortgage business.
Wow.
And I couldn't stop working. I had to take care of my clients. Is that how I got it then?
It could be, when you're as a younger adult, especially when you're taxing your immune system, we're busy with our daily lives, you're stressed. That definitely affects your immune system. It actually weakens it, and so a lot of times you just need rest, right, to simply get over that cold. But for some of us, younger adults, we're working, we're busy. It's totally understandable. But the main point is that for these older adults, these seniors who are more susceptible because either their age, their advanced age, they're living in a facility with other older adults and seniors, they're at that much higher risk. And especially if they have chronic diseases, which many of them already do, such as diabetes and whatnot, they're a lot higher risk and susceptible for infections such as pneumonia. So I really urge patients of mine, especially, to contact me. Even though that we not necessarily need to see them, I want them to at least let me know right away, and then I can at least triage them and tell them, hey, I want you to look out for A, B, and C. If you see these signs and symptoms, I need to come right away to listen to their lungs. I need to take their vital signs. I need to make sure that this isn't pneumonia, order a chest x-ray or whatnot. And so what's great about our practice is that, you have access. We can do a telemedicine conference.
Yeah,
it's not
we'll
just
talk about
house
technology
visits.
later on.
Yeah.
But,
So if their son or child of an older adult has an iPhone or whatnot, there's a rash. Maybe there's an injury. They might have fell. And they want me to take a look at it. Well, you could just telephone conference me. We could FaceTime or Skype. And a lot of these things we can triage through the advances of technology. And it's really great. And so a lot of times patients, they just really appreciate that with our practice, not only is it unique that I can come there whenever we need to, but a lot of times I can triage them, very readily with the advances of technology.
so back to walking pneumonia.
Yeah.
I had it for I would guess I had it for 4 months because it didn't go away.
Wow.
'Cause I couldn't stop working.
Wow. That's,
What would be a cure, or how would you fight
the,
that off?
The cure is, of course, you need medications. You definitely need some antibiotics. Now, if it's treated on an outpatient basis or inpatient basis, it's different forms of treatment. All the same, you would need antibiotics. 4 months is quite a long time. I highly urge you, Percy, maybe call me in interim.
Well, I'll do that.
You got to schedule 8
Well, I'm
months in
signing up with
advance.
you now. So anyway,
Definitely.
But isn't it? But so many diseases. I mean, there's so many chronic diseases that seniors. I got something in my eye here. Seniors don't know what to do about. So we're gonna talk about a few other diseases, but I wanted to talk about a couple of things that came to my mind right off the top of the bat, but I'm gonna forget. I always forget, so I always try to address it right away. What's the disease where you get it around your chest, and it comes out after how many
A
years?
cold?
No. Shingles.
Shingles.
What
Oh,
causes
okay.
shingles, and how do we can you prevent that?
Yeah, definitely. So shingles basically is the chickenpox virus. We call it shingles when you're an older adult because the chickenpox virus lies dormant in your immune system. And as you get older, and usually it's when you're an older adult, around 60s or around 50s, 60s would be the earliest. Your immune system weakens, as we mentioned before, as you get older. And when you have times of stress, whether you're cold or you're stressed out in your daily life or whatnot, it can come back. And that's what we call shingles. And
Why do they call it shingles, by the way?
Shingles virus is a term that was coined. I'm not exactly sure why they called it shingles per se. But that's what we call it today. It's the herpes zoster virus. That's an interesting question. I'd like to know why they nicknamed it shingles. More than likely, it's a term that's used to describe the anatomical appearance of it physically. Shingling, I would assume, would be a basis, but that's just my guess. But shingles, it's something that can be very dangerous for older adults. You have to be very, very, very prudent with senior provider because it's highly contagious, and especially if you have an older adult who are around other older adults or even young babies. They may have a grandchild or nephew, and these things can be deadly, for some of these seniors, and there are a lot of complications. So I highly urge, patients of mine and patients who are listening, if you suspect shingles, that tingling, burning rash, and it's on one side of the body, go call your doctor right away.
Immediately.
And especially if it goes anywhere near the face. If it goes near your face, any part, your ear, your eyes especially, your nose, your mouth, you need to get checked out right away. Because you could lose your vision, you could lose your hearing, you could go blind from it.
I had somebody have it, a relative, a family member of mine.
Oh no, I'm
got
so
it in
sorry.
the face. Yeah.
Wow.
My father got it in the chest. Is that common in the chest, right?
Yeah, so there's these what we call dermatomes throughout your body where they typically like to appear, and shingles is one-sided. So it's going to either happen on the left side of your body or the right side of the body, not
Really?
both. Yeah.
Oh.
And that's just how the virus works. And usually if you have an occurrence, patients who repeat will repeat in the same spot.
Huh.
And with the shingles virus, what's very important, like we touched upon earlier, if it goes towards that facial area or the scalp,
The head part.
the head portion, you really need to have close monitoring with your provider. And I've had patients who are similar, who've had it before, and they were under my care, but I was brought on because of complications from shingles that traveled to the head, to their arteries, and they had developed a stroke as a complication from shingles. And they were left, paraplegic after that.
Really?
Also, yeah, and significant cognitive decline as well and dysfunction. And so I was brought on, a few years after this had happened to a patient. They learned about our services. Actually, it might have been through generations. They might have heard about us. And so I was brought on, and it just comes to attest to the significance and seriousness of this disease. But I was brought on to that case to help the family who was bedbound, to care for them, to make sure that they're comfortable, safe, because they're bedbound. They can't get into a wheelchair. They would need to be transported by gurney, and so it was a really great experience for me and the family to kind of work together.
But are you able to? How do you get shingle? I mean, is it if you had chickenpox a long time ago, is it
It's
almost guaranteed you're
dormant.
going to get it?
It's not guaranteed.
How do you get it then?
There are
What-
vaccines, though. So when you turn 60, of course, we have the shingles vaccine.
Right.
Now, it doesn't...
I'm thinking about getting it now. Seriously,
Some
it's
patients
painful.
can, yeah. I mean, if you're, as early as 50, some patients can get it a little bit earlier.
Yeah.
I would say 50 would be about the earliest that's recommended.
Right. I'm
But
57, so
60 right now is the gold standard, is
Is it
what
really?
the guidelines are for patients to get the shingles vaccine.
was there any way to prevent it though? I mean,
The
nobody
shingles
knows.
vaccine is the way to prevent it.
Oh yeah, okay.
Yeah, and so it's not curative. It's a virus. There's no
Right.
cure for the virus. But the shingles vaccine, I highly recommend. For you to get it.
I want to get it at 59. I think.
Yeah, and it prevents you from getting it, so that when it does, hopefully it doesn't occur. But if it does
But you
occur,
don't know. I mean, it's like it's so random from people I know that have gotten it.
correct,
And it's very painful.
very
I
painful.
heard it's very painful.
And the pain sometimes can last up to 3 months.
Yeah.
2 years, and that's a complication we call post-herpetic neuralgia. But hopefully, patients don't get that complication. But the vaccine is very crucial in preventing not
Right.
only it from occurring, but if it does occur, it's less severe.
But
and
what
that's
brings
the
what brings
take-home.
it out though? What brings it out? Can I ask?
So the main thing is that it lies dormant. And so just like a volcano, right? Like Kilauea, lies dormant, and then it erupts all of a sudden.
Right.
The trigger that breaks that crack in,
Right.
in the asphalt or whatnot, the ground, is your immune system.
Oh, really?
So when you have a weakness in your immune system, that allows it to come out.
Huh.
And so, a lot of things affect your immune system in your daily life.
Right.
And you may think that something simple as stress, emotional stress, right? Whether you're angry, you're upset, or just your daily life, that affects your immune system. And of course, colds and whatnot, illnesses, these all affect your immune system. And these are some of the main things that have it come out.
But everybody I know that has gotten it, and I know several people. It's all men.
Has it been really?
Is it?
To be honest,
I don't think I've ever heard of a woman having it.
I've never heard of. Oh, I've seen many patients who are
women?
females.
Women?
Oh yes,
Oh,
that
really?
have gotten shingles. Yes.
Oh.
I don't have any data as far as there's more male or female clients,
I
but
just thought about
in the
it.
world, but yeah,
Oh.
it's not gender biased at all.
Okay. No, maybe the women don't tell me. But anyway, we're here with Steve Ito from House Call Medical, one of our Generations partners. And That's what I love about you, Steve. You can answer any kind of medical question. These are not even questions that I'm supposed to be asking you, right?
No,
but let people know.
best.
So your insurance covers you, right? Certain insurance covers you, right?
No, they actually we're a fee for service, but we don't send to the insurance company for payment because we're strictly fee for service. The patients who come on board and would like to join our practice or come see us here and there, they pay up front. But the patient, if they have a certain kind of insurance that will reimburse them, they can submit a claim to their insurance company. We can help fill out all the paperwork for you so that all you have to do is just sign it and turn it in. And whether or not the insurance company will give them some reimbursement, partially or none, it's really up to the insurance company and their policy that they have. But a lot of the times, we tell patients to kind of do their due diligence, to really look it up, and we'll do as much as we can on our end to help them to get any reimbursement, if that's possible at all, through their insurance company.
Well, I tell people all the time, though, he goes, well, if insurance doesn't cover it, I'm not going to use them. I said, listen, don't you, like people that I know, like in personal training, they go to personal trainer, they pay for a trainer, same thing, right?
Exactly.
Why do you go to trainer? To stay healthy, right? Mm-hmm. But yours is more critical. I mean, they don't call you until they need something. And so it's really important, guys, if you're listening, it's so important the service that Steve's provides. And now you go only on Oahu, though, right?
All over Oahu, correct.
Yeah, I know Neighbor Island would be kind of hard with the long traveling that you do. But that's what I love about it. And so are you currently accepting patients, though?
Yes, we currently are accepting patients all over the island. So if you get a chance, viewers and listeners, please give us a call. Our number is 726-5062, and we've been more than happy to consult with you and your family, just to meet and greet. We could talk by phone, or if you'd like for me to come and meet in person, I've been more than happy to do that so you can feel comfortable, to learn about how it can bring value to you. The main question I always ask all my patients is, what are your current health needs?
Yeah.
I like to learn about how I could help you rather than just signing someone up. And I think that's an important part of how we bring on patients and care for our ohana here in Hawaii.
Yeah, very important. Like I said, the service is great. You can go to people's offices, people's houses, your kids' school, because I have my son signed up for your service. So thank you very much. Steve, we're going to take a short break. We're here with Steve Ito from House Call Medical. Stay tuned. We'll be right back in a little bit. Thank you.
We will be right back with Percy Ihara from Generations Radio. If you have any questions or want to be part of our discussion, give us a call at 296-5467. That's 296-5467. This is Generations Radio on AM 690 The Answer.
Moon Physical Therapy is here to help you back to recovery. Moon Physical Therapy is located on Ward Avenue across from Sports Authority. Physician prescribed for motor vehicle accidents, workman's comp, or that body pain that comes from rushing to play without warming up. Also event cardiopulmonary rehabilitation with our one-on-one patient care. Moon's Aquatherapy heated endless pool allows for low-impact exercise with less pain on land. We will give you the right exercises to get you back to health. Ask your doctor to prescribe Moon Physical Therapy. Moon Physical Therapy. We achieve results.
Aloha, this is Martha Clopin.
And Al Harrington. Choosing the right Medicare plan not only saves you money, it also helps you avoid headaches and heartaches down the road.
We want to remind everyone
to listen to a Medicare Moment with Martha, Sundays from 9:30 a.m. to 10 a.m. as we help answer important questions on Medicare so you can stay healthy, wealthy, and wise all year long.
Call me at 543-2073, 543-2073.
I was an addict from the age of 13. I finally decided it was time for a change. I walked into the Salvation Army Adult Rehabilitation Center, and that got me ready for the real world. Now, I choose to be guided by Jesus Christ, and today, I'm building a powerful and promising future, free from drugs and alcohol.
Please shop at the Salvation Army family stores. With our discounted sales, your support through your purchase helps men live a clean, sober, and productive life.
Got Vegas on your mind? Get Vacations Hawaii on the line. Vacations Hawaii offers weekly 4 and 5 night Honolulu to Vegas packages, which include 3 meals daily from $6.99. Stay at Hawaii's favorite casinos: California, Fremont, Main Street Station, and Orleans Hotel. Vacations Hawaii will get you there in comfort on deluxe wide-body 767 planes with complimentary in-flight hot meal service. Vacations Hawaii's frequent flyer program gives you future travel discounts and credits. So if you're ready to win big, call Vacations Hawaii at 591-4777 or visit pointVacationsHawaii.com.
Today, more than ever, we local people are living longer than any other state in the Union, with more seniors, baby boomers, and caregivers. Generations Radio promotes the importance to be proactive as we all age. The radio team will focus on issues facing our seniors and their families, finding resources to navigate healthy aging along with financial, legal, and caregiving information. So join Percy Ihara from 5 until 6 each Saturday, right here on AM 690 The Answer. Focusing on the issues facing our seniors and their families today. Here's our Generations Radio host, Percy Ihara.
And welcome back to Generations Radio. I had to take a short break, by the way. Anyway, we're here with Steve Ito from House Call Medical, and we're talking about healthy issues and his service of you're on call. Basically, you do house call. You can go to the office. You can go to people's kids' schools,
at the beach, wherever you're at. I'll be there.
But you know, Steve, one of the best things I think, because I use your service because I'm very busy. Because trying to get an appointment with a doctor sometimes takes a few days or a few weeks.
Exactly.
I mean, I remember when a relative fell down, I said, "Well, you better go take them to the hospital." He goes, and see the doctor was, "Well, they're kind of busy. It won't be until next week." I said, "Excuse me?
Yeah.
You need to go see this tomorrow, if not today." "Well, they're kind of busy." I said, No. It's not the issue. They need to go see. Because I see so many seniors out there, they don't go right away.
Yep.
Even my own parents.
And whether it's a fall and they think that it's something minor like a bruise or whatnot, and they kind of brush it off because why? It's just they don't have the access that they would like to have. And at the same time, what's even more disheartening is you have some seniors who call 911, and they call EMS, and
they don't want you to do that.
They go by ambulance, and you end up spending $300, $600 on a ride.
That.
And so, so a lot of these things, can easily be prevented by coming on board if they would like to have some excellent care provided to them at their conveniences whenever they need it. And I think that's a service that is of value. Like you mentioned earlier, a lot of patients pay for, dieting pills, or they subscribe to nutritional programs or yoga trainers and fitness trainers and whatnot. And I truly feel that, that this service is definitely invaluable. You can't put a price on peace of mind.
Well, it must cost you a lot of money for gas because you travel all over.
That's true. Gotta get an efficient car. That's for sure.
It's true. I mean, Steve Jobs, who was the founder of, was he founder of Apple?
I believe it was Apple.
Yeah. He had terminal cancer. And one of the last things he said was that I have all the money in the world. I have all the technology in the world, but nothing can help me. And he passed away. Yeah. So health is so important. You know me, I'm a health kind of nut, even though I don't look like it. I've got to lose about 20 pounds.
Better shape than me, probably.
I mean, I have gadgets all over the place. I've got this new anti-inflammatory.
You got a nice Fitbit watch there.
Oh no, yeah. But I think it's important. Health is so important. More time you have on this earth. My parents are in the late 80s. It's so important to spend time with family. But I think your service is so key. For families that can't take off work to take care of the parent to the hospital, or if it's an emergency. Like I say, you don't want to call. I mean, you wouldn't call 911, but I didn't know, because my neighbors are getting older, that if you call the 911 and the ambulance comes, if they have to transport you, it's big bucks.
Very expensive. And not everyone.
$500 per one-way trip.
And not everyone, and not everyone has really, really top-notch kind of insurances that will cover the ride. Insurance doesn't cover it. Some patients, they're lucky, but I've seen it a few times. But majority, that's not so the case.
Yeah. Because I was talking to a classmate of mine living on the neighbor islands, and they said they took their parent to the hospital, the emergency, 4 times this month.
Wow.
Like,
oh my goodness.
Whoa. Well, they're pretty well off, so they said, I don't worry, we can take care of it. But man, that adds up. That's over $2,000 at least.
Yes, and
for that 1 month.
And a lot of times too, that you have to think about that patient too. Getting transported. For them to be rushed on a gurney, in an ambulance, it's loud, and it sometimes be very intimidating for them. And they know themselves that they're thinking to themselves too, was this really necessary for me? And they're feeling bad about what's going on too. And so, and that's also part of the reason for another patient who's hesitant to get help too, for that same reason.
Yeah.
And I feel that, we can bring a lot of value and help a lot of patients out there who are listening, who have this situation where they either don't have access, they can't be transported by a loved one, or they can't see their physician on that same day.
Yeah, it's so key. Now, I know you work with a lot of seniors, but you also have a lot of baby boomers like myself as clients as well.
Correct.
Right? And their kids.
A lot of sandwich generation patients, we call it, right? We're taking care of our own kids and our parents as well. And, and so it's a great help for these working professionals. When I come to them during their lunch break, maybe they have like an hour or 30-minute lunch break at 1 o'clock. I can kind of stop by after they had a bite to eat or while they're at lunch and they kind of work around them and try to help them with whatever it is, if it's a cold, if it's a rash, if it's a headache or whatnot. And, they really appreciate that convenience, is that they can just text me this morning, hey, I'm not feeling too good. I'm at work today. Why don't you come on down? Head right over there. And for some of these clients and their children, if they're at home, if there's a babysitter or whatnot, then they can't come home. And as long as I have the permission from the parent, I can go over there, take care of their child, whatever it is that they need, and update their pediatrician about what was done. And so it's really frees up and saves you time, right? A lot of patients say time is also invaluable. Time is money. Time is precious. And so it saves you a lot of time as well, as far as having to wait in a waiting room for an hour, drive there through traffic in the middle of the day. And so a lot of patients who are sandwich generation, boomer generation, such as yourself, boomer babies, they really appreciate our services.
Yeah, I think for professionals as well, dealing with this, time is everything. I worked for Nextel back in the day, like in the late 90s, I think, for about a year.
Mm-hmm.
And one of the key things about Nextel was interesting. We only sold the businesses back in there. And there's nothing about your medical story, but I'll tell you real quick about time. So when we only sold the businesses, we didn't sell to consumers. I didn't sell to my friends. If they want to buy it, they got to ask me.
Oh.
But how we went to businesses is I say, Stephen, you're a professional, you're a business, you're busy, and that. What's the one thing that you can want that can give you that's going to make you more successful? Would it be a better assistant, a good computer, a better phone, or time?
Time.
100%. Everything.
Mm-hmm.
And even my busy schedule, I have to pigeonhole certain times of my day to do certain things, and that's it.
Oh yeah.
My calendar's all got stuff all over the place. But time, guys. So if you're a professional out there dealing with your parents, dealing with your kids, dealing with yourself, what's interesting is that what I like about your service, Stephen, is remember my son got some kind of a lesion on his stomach.
Oh, correct.
It was weird.
Correct.
And he plays baseball, right? So we were at the field. It's like, I had a friend of mine. We play at Quantico, and he's a doctor himself, by the way.
Oh, really? Oh.
And he fell down, and he got a bruise on his hand.
Oh no!
And it looked like flesh. I think a week or 2 weeks later on, we thought it was flesh-eating disease, and it was.
Oh, no way!
But he caught it early enough because he's a doctor.
Wow!
He caught it early enough, and it staved off. I don't know what he put, antibiotic or something on his hand, but you can die from that.
Oh yes, that's quite rare. And so that was in Quantico?
No, nothing against Quantico.
No, I'm just kidding.
But it could be any part.
Yeah, it could be anywhere, anything. The beach, could be the water, anything really. Coming in contact with a rare flesh-eating disease. Wow.
Hey, it says rare, but
wow.
I know of 3 cases.
Wow.
I heard of one on Maui, the Big Island, and I think 2 here. it can happen. I mean, I don't care how rare it is. If it happens to you, it's not rare. It's not rare enough.
That's true.
But I saw this lesion on my son's stomach. I took a picture and texted to you. That was kind of cool.
I remember. Yeah,
it's a great service.
So telemedicine, they're in action right there with Percy.
Like early evening, I think.
Yep.
Too.
Then I went ahead, took a look, asked you a few questions.
Yep.
We went over some things together, what to look out for. We even were able to send some medications.
Medicine.
Yep.
So that's what's cool. You can prescribe medicine. You send it to which place I want to go to pick it up.
Exactly. Any pharmacy you like. So that's another example of how we could kind of help service you.
Yeah.
And save you some time.
Well, that's the main thing. But what the key thing is, I was able to get on it right away.
Exactly. And that's the most important too, is, for your son, whether it's your child, whether it's another loved one, so your uncle, your auntie, your tutu, your grandma, whatnot, just having that access to care when you need it. That's what we do.
Okay. So a couple things. I've been reading the news. You've been reading news about things going on. It's crazy health issues now.
Lots of things. Lots of changes.
What's going on? I mean, first of all, before we get into ringworm, because I've been hearing a lot about it, kind of scary, and mumps.
Okay, gotcha.
What about, people getting food poisoning?
Mm-hmm.
It's so, I don't know if it's common, but we see more and more of that. But what are some of the identifying factors of food poisoning?
Okay, yeah. So there are a lot of things typically with stomach flu, right, so to speak. Whether you got upset stomach, it's aching, you're nauseated, you might have a slight low-grade fever, might have some vomiting or diarrhea. So these are all signs and symptoms that something's going on and that you should get evaluated. Whether or not it's something that was from, undercooked eggs, or whether it was a virus from someone not washing their hands and you ate the food that was prepped by that person. These are all different things that you should go in to get evaluated for, so that we can help you to figure out what was the source.
Okay, so I worked in the restaurant business for 10 years when I was between my junior year and senior, and then all the way to I was about 28. And my understanding is that you don't get food poisoning right away. Is that right?
It takes some time to incubate.
Like, what's the time?
But
what time is that?
A lot of patients, the earliest onset would be a couple hours.
Earliest onset?
Earliest onset could be a couple hours, and some patients even immediately after, which is a couple hours is pretty immediate after you've had a meal, maybe an hour or so. They already start to feel upset. But it could be a couple hours to even longer. It could be 12 hours later.
Right, I heard that.
And so really it's just getting seen by a provider to make sure that you're safe, that this isn't something else going on, such as hepatitis or anything like that, which we recently had an outbreak here in Hawaii.
You're scaring me, Stephen.
No, well, you had your vaccine. You should be okay.
Yeah.
But yeah, so, it can be a really quick, insidious onset, or it could be a little bit delayed, 6 hours later, 8 hours later. But typically, what I recommend is for you to come in right away. If you're a patient of mine or not, just get evaluated to make sure that you don't have any complications from it.
What does the evaluation take?
The main thing that what we're concerned about is, of course, during hepatitis A outbreak, that it wasn't hepatitis A, right? But secondly, at the top of many providers is that it's not a complication with dehydration, especially with older adults. So if we're talking about our audience right now, these baby boomers who are listening, and older seniors, we're worried about dehydration. That's a killer. When they're not drinking the normal amount of fluids throughout the day, they've had diarrhea, and they've had some vomiting episodes. It can be very dangerous for an older adult who already has less total body water than we do as a younger adult. So they're more prone to dehydration. So if you notice anything as far as changes in behavior, fever, whatnot, they need to get checked out right away, immediately. So dehydration is one of the main things.
Especially if they're dehydrated and don't take their medication.
Exactly. And a lot of them are taking multiple pills, right?
Oh, yeah.
So these are things that it compounds the issue. And so for these older adults who are listening and patients of mine, I really, really, really highly recommend that they get close follow-up.
Yeah, that's one thing. Like, people who go to personal trainers, physical therapists, they really got to stay on top of these issues, yeah?
Yes.
Now, you're kind of scaring me. Hepatitis A. What can you tell me? What exactly is that?
Yeah.
And how do you get that?
Yeah, so hepatitis A is another virus, and that's why we get a lot of these vaccines for. It's very easily preventable through the vaccinations. There's 2 doses in the series for hepatitis A. For most of us adults who are born, in the 80s or whatnot, you probably had the vaccine. Hopefully, it was approved. I think probably 90s or so, or by early 90s. But anyway, it's a virus, and it's the virus that attacks the liver. It causes inflammation of the liver. It can lead to scarring of the liver, which we call cirrhosis, and it can lead to other complications in rare cases. It's not life threatening, unless there are some really rare, serious complications that may happen. But for the most part, it's a very livable disease, and it can be easily just monitored and to live with if you were unfortunately contracted by hepatitis A. So hepatitis A, though, we did have a scare with the scallops, as we know, as a source of infection. And Dr. Sarah Parker, our state epidemiologist, and their team, they did a great job in tracking down the source of infection. And I really commend their efforts in this past year.
No, they did a great job. They've done a great job for years. But yeah, that was kind of scary, though. Okay, the big topic now.
Okay, let's go. Fire away.
What's the rat lung one?
Oh, rat lung worm disease.
Then we'll get to the mumps.
Okay, sure. So we've identified and kudos as well to the state epidemiology, Dr. Sarah Park and their team. The way that it's transmitted is, first you have these infected rats who have the parasite. And in the rats, when they get the parasite, the worm travels, the larva, to the lungs, and these lungs actually kind of these rats actually cough up in their secretions the larva.
But what's funny, what's interesting about rats? They get the rat lung disease. They don't die though.
Well, it's not necessarily a deadly.
Not for them.
and so they cough up the larva actually from their lungs. They ingest it, and that's how it gets in their stool.
Really?
And then from their stool, you have maybe snails or whatnot, and then they transmit it to produce, whether it's like other modes of transmission would be like crabs and shrimp, stuff like that. But slugs, going over the lettuce, eating the lettuce, and then they carry with them the stool. The larva, and then the eggs, right? And so we ingest it. If you're eating salads and it's raw, it's not washed or prepared thoroughly, and so then we ingest it. And for us, it doesn't necessarily travel in humans to the lungs, but some of the larvae can travel to the brain, and complications such as meningitis are things that can be quite scary for patients, and dangerous, of course, as well. Yeah. And so these are things where we highly recommend for patients, of course, for all of us to wash your produce thoroughly, right?
Yeah.
Maybe cook very thoroughly as well if you have any vegetables.
Oh yeah. Okay. What about the big thing now? How are we getting all these mumps cases?
So what's great here in Hawaii and in America in general, we're pretty well vaccinated. It's like a ring of protection, right? So if you have all of us, imagine patients and families who've gotten the vaccine and we're in a nice circle holding hands together, we're protected, right? Nothing can get inside. But then you have 1 or 2 patients here and there who have not gotten it for various personal reasons or whatnot. And that kind of breaks that chain, that protective chain of immunity. And you have these cases where now you have someone getting infected. It is an outbreak. It's something that has happened. Yearly. There are patients in Hawaii who've gotten mumps every year,
right?
But not on this scale, of course. And a lot of it, can be due to that fact. That everyone's so well vaccinated that some patients say, "Hey, why do I need to get it?" Or for various other personal reasons for not getting vaccinated. And so when you do have these symptoms that are cold-like, and you're thinking, oh my goodness, I haven't gotten vaccinated, my child or whatnot, or myself, and you have swelling of the glands in your throat, your neck here, definitely go get evaluated right away. We need you to get it. We need to quarantine you just in case you need to stay away from others. so that it doesn't spread, because highly contagious virus. And so, if you do have these signs and symptoms, please get checked out right away.
Yeah, it's so scary, isn't it?
It is.
Now,
It is.
I know you work with a lot of seniors, and I mean, depending on who you talk to, there's so many drugs out there for Alzheimer's, and not, some may work for certain people, some may not. For the most part, Alzheimer's Association won't tell you that you can stave off anything with Alzheimer's, but Hawaii, we live so long that you're seeing more and more of these cases. Yeah, how does the family deal with that from a medical side?
What I like to tell all patients of mine, and even patients who are listening, and their families who have a member with the disease, there's a lot of things that you need to do to plan ahead of time, especially if you're given the diagnosis or it's suspected because it runs in the family. One of the most important things is really the living situation. That's one of the things that I see more frequent in my patients, is that you have a patient with Alzheimer's disease and they're living alone, or they only have their spouse to care for them.
Yeah,
and that spouse can't really meet those needs 24/7.
And it is needed 24/7.
It is needed 24/7, and especially with the more advanced cases. And so that's where we kind of come in as well. We help these patients, these family members, with patients who have Alzheimer's, to kind of prepare. So when they come in as a member of our practice, we do a home health assessment for them. We assess their living situation, making sure that it's safe, that if they want to live at the home, we make sure that they're safe to live at the home. Decision making is a big thing. Having a power of attorney, making someone, a family member, to be delegated to make those decisions when needed, because there will be a time when that patient can't. Financial situations as well. Who controls the money? Is another big thing. And of course, transportation. Making sure that they're able to get to and from their providers, their healthcare team when needed. And so when my patients come to me and they have a member who is dealing with this unfortunate situation at times, and they're bedbound, we really try to come in to give them as support as they need. And they really enjoy that. At least we're there, coming in at least on a monthly basis to try to help them with whatever they need.
Yeah, it's really so important to keep control and stay on top of that. The last item we want to talk about is diabetes and hypertension.
Okay.
We're seeing, so much growth in that, of people with that disease. How does your practice help that? And because I know it can, but continue monitoring, right?
Oh yes, and it's an epidemic here in Hawaii. We have great food here.
Let me tell you, I know I've been to almost all the restaurants.
Oh yeah,
I love my food.
And so with diabetes and hypertension, with a lot of my patients, I like to first start off with just education, patient education. I found, and that was one of my my thesis in school and in my training, is the most integral part in a patient's success. It's just in regards to diabetes, as far as what I studied on. In having him to succeed long term, to prevent complications. Having that patient understand what food choices to make is crucial. Not a lot of patients truly understand what things they should be eating and avoiding. And along those guidelines, their exercise as well. Trying to find a time, the right thing that they enjoy, to keep consistent. These are two of the main things that we providers talk about all the time. And in my practice, what's great is I can spend a lot of time with you. We have weight loss programs. We have nutritional education and counseling that I go over with my patients with diabetes. And, you have many patients who are listening probably who take insulin already, where they have to inject the medication into themselves with a needle 3 times a day sometimes to bring their sugar levels down, to control their diabetes. And it's very difficult for them to manage. You have to stick yourself with a needle 3-4 times a day, check your sugar levels. Yeah. And so, diabetes and hypertension are very complex, but I spend the time with you to really understand, what it is you're doing, why you need to do it, what happens if you don't, and how to do it properly to train you to carb count, to watch what you're eating, to check your blood sugars properly, know when it's dangerous, when it's too low, what to do. And so I can spend the time, put you in my program, and really, really give you the training. Now, all the end, it comes down to the patient, their family.
Right.
You can lead a horse to water, but you can't force him to drink, obviously, right? So, as long as the patient and the family is on board and they're willing to give it a try, it's great. I've seen a lot of patients turn around.
Yeah.
So,
well, we're here with Steve Ito from House Call Medical. He's one of our Generations partners. He's in the magazine, but he does house calls. And so it's really important to understand that your health is the most important thing. Obviously, family too, and in your church. But health, you cannot live without health. And so I highly recommend you check him out. But also to be proactive about healthy living, right? Because why only recently we see this epidemic with diabetes and hypertension?
I'm not.
We have more restaurants today than we had 20 years ago. That's for sure.
That's true. I'm not sure if it's something that's recent. I really think that it's ongoing. This is something that not only affects us in Hawaii, but as a nation.
Yeah.
Diabetes specifically in Hawaii is an epidemic. And, a lot of it too has to do with just really our culture here, and education. We have a great, wonderful culture. It's so diverse. There's so many temptations with that.
Oh yeah.
and our culture too. We're raised growing up. You finish all your food on the plate. Don't waste it. Right. I'm sure we've all heard that.
Oh yeah.
And so some of these cultural aspects too, and the great food and our way of life here, are something that attribute to it. But all it takes is a little education, I think, and understanding and how you can balance that out. As far as hypertension goes, which we've touched on lightly, hypertension is that silent killer. You don't really know what's going on.
What causes that? Just stress or diet or?
Your blood pressure is affected by all those things. Diet, your exercise, stress, and a lot of times those are all things that are easily preventable, right?
Oh, absolutely. And that's one thing we try to tell people is that be proactive versus reactive, because reactive means you're going to be going. I just found out a good friend of mine got diabetes. And so I said, are you going to dialysis? He goes, yeah, 3 times a week.
Oh, geez.
Wow. I've known this guy since 1978.
Wow. Oh, my goodness. And so that's the sad part of both of these illnesses, is that it can lead to damage to the kidneys. And dialysis is a sad reality for some of these patients. And it's a hard way to live. So in regards to both of these chronic diseases, which affect each other, put you at higher risk for one another, whether you have hypertension or high risk diabetes. You have diabetes, you probably already have hypertension, if not close to it. So, in Hawaii specifically, I really think it's just about a lifestyle change. Not necessarily cut everything off cold shoulder, but it's called moderation, and having the right food choices and living a healthier lifestyle.
I encourage everybody to exercise.
Yeah. Go to the beach. It's beautiful here in Hawaii, 24/7 days a week. Do some yoga outdoors. Go on a walk with your friend. So a lot of ways to kind of change your lifestyle so it's healthier. You can live longer.
Yeah, well, we're here with Steve Ito, our resident house medical doctor here. Well,
nurse practitioner.
Who actually can prescribe medicine. So it's really cool that he does. Steve, again, your phone number and how to get a hold of you.
Sure. So our number is 726-5062. They can also visit our website at housecallmedhawaii.com, and they can take a look at what services we provide. Once again, we're bringing back that door-to-door house call doctor. We take care of you, and we work with all of your doctors. You don't have to give up any of the current doctors that you might have seen. And we try to provide quality care at your home, at the comforts and conveniences of your time and schedule.
Your office or your kids, the kids can sign up too, and they can go to your church.
Church,
yeah,
sure.
Church too, but in the school. So thank you very much.
Thank you, Percy.
We got to get you on here more often because you can answer any kind of medical question, which is cool. But I appreciate your time. But anyway, I did want to mention, don't forget, Generations Magazine has a Facebook page. So please make sure you go to that. Our YouTube channel, subscribe to our Generations Magazine's YouTube channel. And don't forget, KITV does their Aging Well segment every Saturday morning from 6:45 to 7 o'clock. So check that out. Anyway, thank you very much, Steve. I appreciate that. You did a wonderful job. We got to have you back on again, and you're my resident guy too. So, anyway, thank you everybody. Every Saturday from 5 to 6, Sunday from 3 to 4, here on AM 690, The Answer. Aloha and live well.